Hi, I'm Mary Hogan Donaldson. I'm one of the nurse midwives for South Shore Hospital. And this is
Andrea Colucci, one of the nurses in the birthing unit.
So this segment is about optimal fetal positioning or spinning babies. And we have found that if we teach this to you prenatally from the last month of pregnancy on, if you would do this exercise at least once a day when the baby's active, the baby is going to help you get them into the right position. So here's my demo baby. Okay, sort of scary looking. And here's a pelvis that I just caught. I took it out just to show you. Anyway, so here's this, front to back. That's your tailbone in the back. This is a piece of cartilage in the front, so it stretches a little bit, so that's why your hips can feel unstable in the last month of pregnancy. Here's the baby who likes to fit in any way it wants. If you're in a really comfortable chair at work, or you're driving around your car a lot, or you have a sit-down kind of job, babies can lock in looking face up. The baby's like a bagel. The bagel needs to go in sideways into the toaster slot. So in order to get them to do that, we need to have you turn over on your hands and knees and do the child's pose. A great place to look at this after you listen to this video is go on spinningbabies.com, and it's a site that anyone can access and you can see all the different positions if you get bored with the hands and knees one. So what happens is the baby in the last month drops down a little bit and has to make reservations, especially a first baby. A second baby has a lot more room and they totally can go into a wrong position because everything has already been stretched out. So you really want to sort of train them to get in, and the only time they're going to help you is when they're moving. So you have to get them when they're acting a little crazy and doing one of their crazy moves, and you get over on your hands and knees. So Andrea's going to be my demo. And so you get into this position. This is the child's pose in yoga, just like a baby sleeps. And if your back is bugging you, you want to put a cold pack on your back here. Never heat, because that just encourages them to go like this. And you don't want them head up. You want them sideways to roll like this so that they slide out easier. It's easier for them to tuck their chin when they come out. So in an incredibly comfortable position. If you have heartburn though, this wouldn't be a great position. So that's a reason to talk to your provider and say, I can't go upside down, I can't even drink water because it's burning. So this will help turn this baby. And remember, you want to do at least once a day for a half an hour. And if you think that you're in labor, you want to assume this position, and then that'll rule in whether it's a practice session or a real session. Lots of people have lots of practice sessions. So sometimes just the baby trying to fit its way in and gets a little crooked, just touches the edge of your cervix. So if you get in this position, it will tell you that it's real or just a practice session. You should be good to go. Have a nice birth.